province has introduced a bill that, if passed, will introduce two-tier healthcare system. Many doctors, it will allow them to toggle between public and private services. It's an effort to improve surgical wait times and attract more physicians, but there could be some downfalls. Jacqueline Wilson reports.
On Monday, the province introduced Bill 11, and among the many proposed changes to the healthcare system is one that introduces a dual model healthcare system, where certain doctors will be able to choose whether they bill a service to the province or a patient privately on a case-by-case basis.
The proposed amendments in this bill represent a new era for healthcare in Alberta.
There are exclusions. All emergency care and urgent surgeries, as well as cancer treatments, will only be covered by the public plan. There will be no private options. Also, family doctors are restricted from participating in the dual practice at this time.
I think this is a tool that will help us retain physicians and other healthcare professionals that are frankly going to other jurisdictions, and it will retain that activity in the Alberta economy as opposed to sending it to other jurisdictions.
But the Alberta Medical Association isn't sure it'll be a big lure.
Our big concern with at the Alberta Medical Association is how do we potentially add private care to our system that already is struggling with the public system, and particularly when it comes to workforce.
The province says they might make changes to the rules in the future, like making doctors do certain number of public services before they can do private. But at this time, those restrictions aren't in place.
If the private system is more lucrative, and if the patients within the private system on average have less complex medical needs, then the concern is that they're going to prioritize those private patients, and that the patients left in the public system are going to wait longer for care.
And Jacqueline joins us with more on some of the amendments in Bill 11. Jackie, there could also be changes coming to health care cards.
Yes, Sarah, there certainly will be. So the province is proposing that in late 2026, Albertans will actually have to start renewing their health care cards. And the province says that they're doing this in order to prove that you are eligible for coverage, but also to avoid any misuse that could happen. And I did ask the health minister today, will we have to start paying for these renewals? And she said it is a possibility, but they haven't made up all of those regulations yet. Now, this is the latest in kind of a series of changes to our health care cards. I'll go over them now. So the other change is you can now get a mobile healthcare card. As well, there's also been announced that you can add a healthcare number to your driver's license. That'll start around the same time next year, so late 2026. Tara?
Okay, Jacqueline, thank you.